Alright, so this is our friend Oliver, and Oliver has been eating a little bit on his own, but he's still getting supplemented through his feeding tube. So the feeding tube has a collar that's just held by some Velcro, and it has a little Velcro strap to hold the tube back so that there's not some tension, or there's no chance of him accidentally getting that caught between his foot and pulling that tube out. So before I do any food, we want to flush his tube to make sure that he doesn't have any blockage. So I'm just using a little bit of water in a syringe, and it twists on to secure it. And then whenever you're doing any medication or food, you want to make sure that their head is higher than their stomach so that there's no chance of them vomiting. And I only drew up like about 6 mils, and I only gave about half. And then this is, we use recovery liquid as our food base. So you can mix any medications or supplements into these. And then same as with the water, you kind of just screws on there. And then you kind of just want to watch him as he is receiving the food, making sure he's not lip licking or drooling. And then I usually go a couple mils at a time, take a little bit of a pause in between, and then continue onwards just to make sure that he's not getting any air and make sure he's not getting it too fast. I know, buddy. And again, I'm just elevating his head and looking for any signs of nausea or drooling. Good job, buddy. Right. So when I'm removing the tube, I want to put my finger on there just to limit the amount of air that gets introduced in there. And then same as before we gave food, we want to flush it afterwards just to make sure that nothing is in the tube. And you want to recap it and just tuck it underneath that Velcro strap. And sometimes I like to have just like a wet washcloth just to kind of clean their faces, since their collar gets in the way of them grooming themselves. A lot of kitties tend to like that. It just helps them feel a little bit more relaxed, and it's similar to the behaviors that they would express when they were eating on their own. And that's kind of it. You just kind of want to watch him a few minutes afterwards just to make sure he doesn't vomit. And then once he's looking good, we can let him off to do his own things.